Number 9. PARP inhibitors for maintenance therapy in ovarian cancer.
The diagnosis is never easy to hear. It is a battle within the body. With ovarian cancer, cells in the ovaries grow very rapidly, creating damage to DNA. There is an enzyme designed to fix this damage, poly-ADP ribose polymerase, better known as PARP. But fixing the DNA allows the cancer to grow. Using a PARP inhibitor blocks the enzyme from repairing the damage in cancer cells, representing its usefulness in cancer treatment. In 2018, the FDA approved the first PARP inhibitor as a maintenance therapy after a first line of chemotherapy in women with BRCA gene mutations. Until now, maintenance therapy, the use of a therapy to prevent or delay cancer's return after achieved remission, hasn't been widely explored in cancer of the ovaries. Results from a study released earlier this year showed a 70% reduction in the risk of recurrence at 3 years in the group utilizing the approved PARP inhibitor. Researchers hope that PARP inhibitor use will show improved long-term outcomes, arming women for the fight against ovarian cancer.